Unit 4. Physical Education and Sports for Children with Special Needs. At the end of this unit, you will be able to describe the concept of disability and disorder, outline types of disability and describe its causes and nature, adhere and respect children with special need by following etiquettes, identify possibilities and scope in adaptive physical education, and relate various types of professional support for children with special needs along with their roles and responsibilities. Concept of disability and disorder. Concept of disability. Disability is a lack of ability that can affect physical, mental, intellectual, and social life. India provides special reservation and facilities for disabled people, financial assistance and packages. Mr. Narendra Modi refers to them as God's divine body, and their experience, journey and hard work inspire a million people globally. Meaning of disability. Disability is a disadvantage that restricts the smooth functions of movement of a person. It hampers daily routine activities of a person. It relates to physical, mental, developmental problems of a person. It is a disturbance of function, structure of both resulting from a genetic or embryonic failure in development or from exogenous factors such as poison, trauma or disease. Concept of disorder. Mental disorder is a disease which affects a person's health and can lead to long-term symptoms. It is considered to be more complex and serious than physical disorder, as it is far more lethal and can manifest in early stages. Symptoms of mental disorder include personality disorder, anxiety, and psychological disorder. Meaning of disorder. It is normally related to mental disorder. Disorder creates hindrance in an individual's performance and reduces his efficiency. There is no specific time frame for any disorder. It can occur at any stage of life. If a disorder is not diagnosed and treated at time, then it can become a disability. Types of disability, its causes and nature. Disability affect a person in many ways. Many people get affected by birth or any incident during lifetime. Generally, disability is classified into three categories: cognitive, intellectual, and physical disabilities. Types of disability, its causes and nature. Disability affect a person in many ways. Many people get affected by birth or any incident during lifetime. Generally, disability is classified into three categories: cognitive, intellectual, and physical disabilities. Number 1. Intellectual disability. In this type of disability which people lack capacity to learn tasks or process information. It can cause difficulty in reasoning and analyzing things. In this disability, the person have difficulty to take in information and communication. This disability normally occurs before age of 18. Intellectual ability is related to person thoughts, memorizing, understanding and solving problems. Intellectual ability is a special ability of a person. When a person's intellectual ability is less than to their counterpart, then this stage is called mental disability. In simple words, non-able to perform the normal human life mental activities and adaptive behavior skill due to any mental problem or disturbance. Causes of intellectual disability. A. Genetic reasons. Abnormal genes from parents can be a factor for occurrence of this disability. If gene is affected during pregnancy, then it will affect adversely in womb. Down syndrome, fragile X-like intellectual disability are one of few caused due to heredity. B. Problems during pregnancy. Pregnant women who consumes alcohol or drugs can be one of the reasons for occurrence of this disability. Alcohol consumption is one of the main reasons for this kind of disability. Recently, few researchers have found that smoking also causes intellectual disability. C. Problems at time of birth, premature delivery, low birth weight or lack of oxygen during delivery can cause intellectual disability. D. Problems after birth, disease occurred in childhood like chickenpox, typhoid, which causes meningitis and encephalitis damages brain cells. Other than that, poisonous chemicals can damage nervous system, which can cause intellectual disability. E. Poverty and cultural deprivation. Poverty, malnutrition, environmental hazards also cause intellectual disability. Number 2. Physical disability. Physical disability is a condition that affects a person's mobility or movement, usually due to heredity or other impairments such as respiratory disorder, blindness, epilepsy, and sleep disorder. It can be caused by birth or after birth and can limit other aspects of daily life. A. Disability of backbone. This kind of disability is either by birth or due to any accident. Sometimes, it causes lifetime disability. B. Head injury. Any kind of injury to head can cause physical disability. C. Hearing impairment. In this kind all disability, the person's capacity to hear reduces, which causes various social and mental problems. D. Vision impairment. In this disability low vision or blindness occurs. Diabetes or cornea injury cause visual impairments. Causes of physical disability. Various kinds of disability are caused due to following reasons. 1. Heredity. Various kinds of disability are transferred through defective genes from parents to children. 2. Environment. Rapidly changing environmental conditions, pollution and adulteration affected people are affected. Malnutrition is one of reason for disability among children and pregnant women. 3. Lifestyle. Modern lifestyle, changing eating habits and pattern, obesity, lack of physical activity could cause various disabilities. 4. Carelessness during delivery. Sometimes during delivery, carelessness causes serious damage to infant or pregnant women. 5. Use of drugs. If pregnant women consumes alcohol or smoke or drugs, that can cause intellectual disability to baby in womb. 6. Paralysis due to brain injury. 7. Polio. 8. Losing of limb in an accident. 9. Underdeveloped body organs. Number 3. Cognitive disability. It is a neurological disorder that creates hindrance or obstruction for an individual to store, process and produce information. This ability can affect an individual's ability to read, compute, speak and write. Few other causes of disability. 1. Genetic cause is in a family. A particular disability is found, then coming generations are prone to that disability. This happens due to defective gene of parents. 2. Mental health problems. Various disabilities are caused due to depression and bipolar disorder. Normally, it is found that mental health problems are hard to diagnose and treated. 3. Accidents. Today in this fast life, you never know that when, who get victim of accidents. 4. Malnutrition. Malnutrition is a major cause of disability in our country, as it affects physical and mental health. 5. Illness. If anyone suffering from serious illness like cancer, heart disease, diabetes, for a longer duration, can cause any kind of disability. 6. Lack of education. Mental disability can be caused by lack of education, lack of experience, and not consulting a doctor for reference of disease. 7. Poverty. Poor people are more prone to disability due to unhygienic conditions and poor sanitation. This leads to deprivation of basic amenities and can lead to infection with diseases. In some cases, children born in poor families may become disabled since birth due to lack of nutrients and calories during pregnancy. 8. Infectious disease. Inflammatory diseases can lead to disability due to reduced immunity and lack of proper care. 9. Use of intoxicants and drugs. Consumption of intoxicants and drugs can lead to physical and mental disability. 10. Disturbance in endocrine glands. Disturbance in endocrine glands causes disability. Due to these disturbances, the child gets weak in physical and mental state. Nature of disability. The disabled person is often seen as a curse, but in recent years, NGO and government agencies have made efforts to bring them in mainstream. The disabled person has proven their credentials in education and other areas of work, and is now referred to as a specially abled person. Einstein and Stephen Hawking are examples of people with disabilities who have had very special talent, and many have overcome their difficulties and excelled in their profession. Disability etiquettes. Disability etiquette means respectful ways to communicate with and about people with disabilities. Positive and energetic attitude. One should approach a person with special needs with positive energy and attitude. Approach should be warm and friendly. One should not show sympathy for, or, even in certain cases, fear of the person. Communication. Communication should be two-way, establish rapport, use communication aids, and keep tone low. Social etiquette. Make surroundings disable-friendly and comfortable for people with special needs. Offer assistance only if it appears to be needed. Respect their ability to make decisions and judgments, and ask questions before offering help. Develop a culture of inclusion. Physical etiquette. Sit or stand at eye level with a person with a disability. Find a table to sit at. Make eye contact, and avoid touching their equipment. Aim of adaptive physical education. The aim of adaptive physical education program is to provide opportunities to specially able children in games and sports according to their need and requirement in a safe and sound environment where they can achieve physical, mental, emotional, and social growth commensurate with their potential through a carefully planned program. Concept and meaning of adaptive physical education. Adaptive physical education is an adaptive program of games and activities designed to help disabled and physically challenged students develop their potential through education. So, we can say that adaptive physical education is designed to meet the needs of disabled and physically challenged students. Objectives of adaptive physical education. Adaptive physical education, APE, is a specialized program that is designed to meet the unique needs of students with disabilities. The objectives of APE include improving physical fitness. One of the primary objectives of APE is to improve the physical fitness of students with disabilities. This may involve developing individualized exercise programs that are tailored to the specific needs of each student. Enhancing motor skills. APE aims to enhance the motor skills of students with disabilities, which can help improve their coordination, balance, and overall physical ability. Promoting social interaction. APE programs often incorporate social activities and team-building exercises that can help students with disabilities develop social skills and build relationships with their peers. Increasing self-confidence. APE can help students with disabilities build self-confidence and self-esteem by providing opportunities for them to succeed in physical activities and develop new skills. Developing lifelong fitness habits. APE seeks to help students with disabilities develop lifelong fitness habits that they can carry with them into adulthood. By teaching students the importance of physical activity and exercise, APE can help promote long-term health and wellness. Methods of adaptive physical education. The methods of adaptive physical education are as follows. The program should be according to personal interest and need. Before determining a program, teachers should be well aware of the interests, natural tendencies, abilities and post-experiences of children. Modification in the equipment. Equipment should be adapted to the disabilities of children, such as a ball with bells to create sounds and learn direction and distance. Change in environment. Disabled children should have a separate play field, sound and light, and rest at regular intervals. Modification in the rules. Students should be given extra opportunities to show their skills, 2 points in place of 1, and modified in the time of activities by giving extra time or rest. Modification in the strategies. Different instructional strategies such as verbal, visual and peer teaching should be used to enable students to learn independently. Training of teachers. Teachers must have the ability to transfer training to Divyangs. Medical checkup. Medical staff should be present to ensure safety equipments and physical checkup before determining a program for children with deformities. Role of various professionals for children with special needs. Number 1. Counselor. Counselors provide advice, help and guidance to help all students, including those with special needs, achieve their full potential. The following are some of the other important services that school counselors provide. Identifying the students who should be assessed to determine eligibility for special education. Counseling sessions with special education students. And collaborating with other school and community professionals, not only limited to teachers, school psychologists, physical therapists, occupational therapists, speech and language pathologists in the delivery of services. Number 2. Occupational therapist. Occupational therapists assess and treat physical and psychiatric conditions to prevent disability and promote independent function. They work in partnership with family, schools, and healthcare professionals to meet the Divyangs' needs. Occupational therapists design and implement programs to maximize potential and develop equipment to improve existing mode of functioning. Occupational therapists collaborate with teachers, special educators, and parents to develop and implement programs, provide counseling, and support classroom activities. Activities of daily living, self-care skills like daily dressing, feeding, grooming, and toilet tasks. Also environment manipulation like handling switches, door knobs, phones, TV remote, etc. Occupational therapists use qualitative and quantitative assessment methods to diagnose dysfunction and develop an individualized plan of care. Occupational therapy develops motor skills such as gross, fine, and in-hand manipulation. Number 3. Physiotherapist. Physiotherapy is a clinical health science and profession that aims to rehabilitate and improve people with movement disorders by using evidence-based, natural methods such as exercise, motivation, and adaptive equipment. The practice of physiotherapy involves assessing the issue at hand, that is most often the physical state of the child. Monitor the child's progress and alter the program as the child improves, develops, and grows. Organize and practice the slow-pace exercises like walking and swimming for the child. Work in conjunction with other health professionals to meet all the child's needs is a thorough and comprehensive way. Help the families to understand the child's problem and to teach parents the skills to develop the child's ability to perform everyday tasks. Number 4. Physical education teacher. Physical education teachers must observe students with disabilities to ensure they are able to participate safely and successfully, as regular physical education teachers are not equipped to include them. The physical education teacher efforts in the following ways. Physical education teachers motivate normal children to talk with Divyang children, increasing friendship and self-confidence. They organize the functions along with the other teachers and parents so that they can discuss about the increase in participation in sports of Divyang children. The sports programs have been organized differently for differently able children so that there is an increase in the motor skills like speed, strength, and coordinative abilities. Number 5. Speech therapist. Speech therapy is a corrective or rehabilitative treatment of physical and/or cognitive deficits disorders resulting in difficulty with verbal communication. This includes both speech and language, both receptive and expressive language, including reading and writing. Speech therapist helps to remove the problem related to speech therapy. Articulation, speech, language and swallowing difficulties can be caused by a variety of causes, including developmental, or acquired. Expressive language skill. Language encompasses comprehension, expression, processing, pre-literacy and literacy skills. Listening skill improvement. A speech therapist helps children develop a vocabulary and communicate with their classmates. Stuttering. Those with speech abnormalities, problems with speech rhythm and fluency, and difficulties swallowing are treated by speech-language pathologists. Voice and resonance. When a child coughs, has a cold, talks too much, or has any other reason for their voice to resonate, a speech therapist can assist treat it. Number 6. Special educator. Special educators use remedial instruction and instructional materials to meet the needs of children with learning disabilities. A special educator can help the Divyangs in following ways. Special educators suggest exercises for Divyang students to improve their performance. Modifications include reducing the number of questions students must answer at the end of a textbook chapter, allowing a student to answer aloud instead of writing an answer, and allowing them to do an activity that is different from others. To design the adaptive lessons for the Divyang students. To develop the different lesson plan for different students. To make the lesson plans according to the capacities of children and to implement them and to divide them. To apply the personal educational program for every individual, to evaluate the performance of students and to maintain the record of it.